Hi, my name is Dr. Tarang Vora. I am a consultant pediatric neurosurgeon at Apollo Hospitals, Jubilee Hills. Today we are going to talk about craniosynostosis, that is baby having an abnormal shape of the head. It is estimated that around 1 in every 2500 babies in India is born with an abnormal head shape. Due to the frequent use of overhead mufflers and scarves, it is underdiagnosed and underreported. So what is craniosynostosis? A newborn baby's skull is very soft and moldable. It has multiple joints that allows the brain to grow as the baby grows in age. Around 2 years of age, the skull bones begin to join with each other and become one full rounded skull. Craniosynostosis is a birth condition in which the bones in the baby's skull join or fuse together too early, that is before 2 years of age, before the brain is fully grown and developed. In some instances, the brain might not have enough room to grow to its usual size because of this early fusion. This can lead to buildup of pressure inside the brain and in the skull, limiting and slowing the growth of baby's brain. As the baby's brain grows with age in the skull, not having any space, it gets more and more abnormal shape of the head. What problems do these babies have? Of course, there will be an obvious cosmetic deformity which affects their confidence as they grow older. Many of these problems can depend on which sutures or joints have closed prematurely, when did it close, and whether or not the brain has enough room to grow. Sometimes, if the condition is not treated early, there will be buildup of pressure inside the baby's brain and the skull, and this can lead to problems like blindness, seizures, and brain damage. What causes craniosynostosis and abnormal head shape? The causes in most of the babies is still unknown, but in some cases, craniosynostosis is thought to be caused by a combination of genetic and other environmental factors such as what the mother consumes or comes in contact during the pregnancy, certain medication that she has used during the pregnancy. Most often it is reported in children of mothers who have thyroid issues during pregnancy or in those who have had some kind of fertility treatment during the early part of the pregnancy. How do we diagnose craniosynostosis? Craniosynostosis is usually diagnosed soon after baby is born. Sometimes it is obvious on seeing the baby that the skull shape is abnormal. Other times it can be seen only on close inspection, that is after 6 to 8 months of birth. Your pediatrician can identify craniosynostosis during a physical exam. Having said that, there is no better diagnostic test more better than the eye of the mother. What a mother can notice can easily be missed by a pediatric caregiver because of the severe burden of the work. Usually, the signs of an abnormally shaped skull include an elevated eyebrow, bulging eyeballs, no soft spot on the baby's skull, a raised ridge on the skull, slow growth or no growth of the baby's head size over the time, which is measured with a tape. In rare instances, baby may present with seizures or growth delay. If it is suspected, a low dose CT scan can be done to confirm a prematurely fused skull. How do we treat craniosynostosis? If detected early, that is within 6 to 8 months of life, we can perform an endoscopic procedure to separate the joints and give the baby a molding helmet as the skull is still moldable. But if it is detected after 1 year of age, then more extensive and open surgery is needed to correct the head shape. If you feel your baby is having an abnormal head shape, please do not hesitate to consult your pediatric caregiver for confirmation. The sooner we treat, the better the results are. Thank you.